we talked about this remedy, Euphrasia. First of all, we saw what Dr. Clark says about this remedy, that the corolla of this remedy looks like a pupil, and hence people knew that this remedy is for eye. Right, so it has great prominent action on eye, as we've already seen. And we started talking about the headache of this remedy in the very start. So we saw that the headache was also catarrhal. Since this whole remedy is catarrhal, so the mucous membranes are affected and secretions are there. So along with the headache, there is nose or eye symptoms and watering discharges. That is why it is called as catarrhal headache. The pain was a stitching kind of pain that this patient felt, and it was as if the sensation was as if bruised, and as if it was bursting. The head was bursting. Yeah, and along with the headache, there was dazzling of eyes, which is also actually a very important symptom in this remedy. Dazzling of eyes was also there. So this was all about headache, which was very sweet and little. And then we talked about the eye related symptoms, which were, there are a lot of symptoms related to eye, because eye is the main sphere of action. So we see that again here there is a catarrhal condition. So catarrh is a very central word to this remedy. This catarrhal condition, that is why there is obviously there is going to be lacrimation, right? And the discharges are going to be, as we've seen, the discharges are going to be copious. They will be profuse. What is the meaning of copious? They will be profuse. There will be a lot of discharges. They will be acrid. They will be excoriating. They will be corrosive. Okay, they will be excoriating discharges. And we've seen that they can be watery, thin or thick. They can also be first of all mucus, and then they can turn purulent, which is actually most of the times yellow and thick discharges, right? Then we saw the kind of pain that they feel in the eye. So the pain is mostly cutting type of pain, right? The sensation that they have is as if there was pressure from sand, as if there was dust in their eyes, and there is this dryness and burning that they feel, and also biting that they feel in their eyes, right? Then itching is something that we talked about. So itching is very violent in this remedy. Itching is violent in this remedy, and hence he needs to keep on rubbing his eyes and also winking his eyes, right? And the lacrimation we saw was hot, as Dr. Fatak mentioned, and it was acrid. It was a lot of actual lacrimation came from windy weather or cold air. It was aggravated in open air, when he was lying down, and when he was coughing also. Okay, then we saw that there was this eyelids which were involved. So the mucous membranes of the eyelids was involved, and it led to inflammation, redness, smarting, and hence this kind of a picture came up. The eyes become very red. There are dark blood vessels that you can see in the eyes, congested blood vessels you can see in the eyes. Okay, this kind of smarting sensation, this burning and smarting in the eyes. That is how the appearance of eyeball will be. There's the eyelids get agglutinated in the morning. The eyelids get very puffy, so there's puffiness of margins of the eyelids mostly. Okay, and then there is vision issues also. The vision gets blurred and dim, and you see they feel as if there is a hair which was hung, and they want to wipe it away. So anything related from acute conjunctivitis to opacification of cornea, paralysis, anything can be involved. In menses, we saw that they last only for 1 hour or 1 day, right? Then we went on to talk about the respiratory symptoms that this remedy shows, in which the mucous membranes of the nose were involved, and they gave us a bland discharge. But the lacrimation from the eyes was always acrid. So this is a combination that we see in Euphrasia. And completely opposite we see in Allium cepa, where the nose symptoms are nose discharges are acrid and the lacrimation is bland. Then we see that the nose is first of all involved. There is fluent discharge from the nose, coryza is there, okay. And after for 2 days this might go on, and after that larynx is affected, because of which there is cough, right? and this larynx feels that there is irritation, there is tickling in the larynx, which gives rise to this cough. And after this cough, we see that there is pressure beneath the sternum. And we see a very characteristic differentiation between the modalities of coryza and cough. So coryza and there is a cough that we have. So we see in coryza there is aggravation at night, but in cough there is aggravation during daytime. We see that in coryza there is aggravation from lying down, but in cough we see that there is aggravation from lying down. Okay, and both of them are aggravated in open air. Okay, and cough appears after disturbance of hemorrhoids or piles, and there is no cough at night like bryonia and manganum. Then we've also seen that the expectoration is very easy, and sometimes it might happen that they are trying to cough out the phlegm but vomiting happens. On the external nose, you see that on the right side of the nose there can be a tumor of flat cancer that these patients get present with, and this patient is a chilly patient. And we see that then we talked about actually fever. So in fever we saw that there are 3 stages: the chill stage, which is very prominent, there is a heat stage, and there is a sweat stage. And in heat stage we saw that there is red face plus cold hands. Okay, and the heat was descending. Okay, the heat descends. In the sweat stage we saw that sweat was mostly on the front part of the body, and we also saw that especially on the chest. And during sleep at night also it was there, and it was offensive. Then we saw that measles are there and pulsatilla like symptom come out. And another noteworthy symptoms, we saw that there's frequent yawning, and that too when they're walking in open air. Okay, then we talked about a case by Clark in which we saw that this remedy is also used for prostatic troubles, and it can also be used as an eye lotion. So this was all about this remedy, and this was what Dr. Phatak, Dr. Kent, Dr. N.M. Chaudhary, Dr. Clark have talked about this remedy. We've covered almost a lot of it, and all the most important points we have already covered. So we've covered the whole N.M. Chaudhary, the whole Kent, and the Phatak we've not covered in its entirety, but we have taken the important points that have been mentioned by other authors as well. Okay, so that's about it for today. Let's meet when we were discussing some other remedy.